The Community Development Outreach Team are a small team working with diverse communities and vulnerable groups throughout the whole of our region. We share important early prevention health messages, support people to access a range of healthcare services, including helping people to register with a GP, and empower people to ask for interpretation and translation services. It is important for the team to go where the communities are, so we're often out and about in different locations, attending events, places of work, or visiting residential sites. We listen to communities to understand the barriers that they experience, as well as what is important to them when accessing healthcare services. This information is used to shape the development and delivery of services. Gypsies and travellers are a minority ethnic community in the region who often experience disadvantage. The team works with this community to build trusted relationships and to help connect them to services that can help address their health needs. You will now hear from a member of the Gypsy and Traveller community who attended a warm and well-being event that the team organised to offer support and a variety of services to the community.
During the winter, living in a trailer is very cold, and it also works out very dear to heat, as the gas runs out very quickly. The team had been visiting the site for a while, and when they set up the event, especially for the community, I went along, and it was really welcoming, and everybody made an effort to talk to me and explain what they were there for and what they were doing. And I'm a smoker, and I've been thinking about giving up for a while, so I decided to sign up for the smoking service because I really can't afford to pay for my fags anymore. I've got 3 children, and I wanted to be fit and healthy for them. I was also able to get my flu jab when I went there as well, and that's something I wouldn't have done if I'd have had to go up to the chemist.
The team are building relationships and trust between the community groups and the health board. This allows us to share accurate information about a range of health issues, as well as how to access services like NHS Wales 111 or the Minor Ailment Scheme. The team also translates information into a range of community languages. As a result of our partnership working, we are able to signpost people to other agencies who can help with things such as accessing grants, food banks, housing, or financial support. It's sometimes difficult to measure the difference we make, but feedback from our community shows that we are really making a difference to people's lives. For more information about the work of the Community Development Outreach Team and the communities that we support, please email inclusion.hdd@wales.nhs.uk.